Hello everyone, this is Dr. Fagan from the Academy of Online Radiology Education. I work at Baylor College of Medicine. This month, we have curated some interesting literature in GI radiology. Stricturing is a complication that affects more than 50% of Crohn's disease patients in their lifetime. Strictures in Crohn's disease are initially due to inflammation, but some strictures can develop histologic changes that lead to fibrostenosing lesions. Current medical therapies for strictures are aimed at reducing inflammation rather than treating the fibrosis. The treatment for strictures generally requires surgical intervention. Recently, medications such as anti-tumor necrosis factors have been found to help maintain clinical remission and avoiding intestinal resection in patients with stricturing Crohn's disease, likely by delaying the formation of fibrostenotic changes. Currently, there are no reliable non-invasive methods to assess these changes. This study aimed to use CT enterography to assess pathologic changes in symptomatic stricturing Crohn's disease and to use these findings to predict surgical risks. Bowel wall thickness less than 5.9 millimeters, luminal stenosis greater than 3.35 millimeters, and upstream lumen less than 27.5 millimeters were found to be independent predictors of surgical-free survival for symptomatic stricturing Crohn's disease patients. Histopathological analysis of bowel wall in these patients showed bowel wall musculature hypertrophy was significantly correlated with luminal stenosis seen on CT enterography. Duodenal adenocarcinoma is a rare malignancy accounting for less than 1% of all gastrointestinal tract tumors. However, the incidence is increasing. Surgical resection is the only potentially curative treatment for duodenal adenocarcinoma, making adequate staging crucial for treatment planning. This study analyzed the performance of routine contrast-enhanced CT for TNM staging and resectability of duodenal adenocarcinoma, and compared to intraoperative and pathological findings and follow-up PET scans. Contrast-enhanced CT was found to be insufficient for staging, with the correct T-stage assigned in only 54% of patients and underestimation of T-stage in 27% of patients. Curative surgery was aborted in 19% of the patients due to finding unexpected local invasion or metastases. These findings demonstrate that routine contrast-enhanced CT is insufficient for staging and determining resectability in patients with duodenal adenocarcinoma. Gastric cancer is the third leading cause of cancer-related mortality worldwide. Locally advanced gastric cancer has a poor prognosis with a 5-year survival of only 26%. Previous studies have shown that neoadjuvant chemotherapy improves surgical outcomes and prognosis, but the response is variable. This study investigated the efficacy of diffusion-weighted imaging and dynamic contrast-enhanced magnetic resonance imaging for the early prediction of response to neoadjuvant chemotherapy in patients with locally advanced gastric cancer. Patients received an MRI prior to undergoing neoadjuvant chemotherapy and radical gastrectomy. The authors found that both diffusion-weighted imaging and dynamic contrast-enhanced MRI can effectively predict the pathologic response to neoadjuvant chemotherapy in locally advanced gastric cancer, with ADC being the most valuable imaging parameter. Neoadjuvant chemoradiotherapy, followed by radical resection, has a pathologically complete response in 1/5 of patients with rectal cancer and can reduce surgery-related morbidity. However, response to neoadjuvant chemoradiation is variable, making preoperative evaluation of response vital for clinical decision-making. Currently, assessment of neoadjuvant chemoradiotherapy response is impossible on pre-surgery due to lack of reliable markers. This study aimed to assess the ability of MRI radiomics features to predict response in patients with rectal cancer. The authors found that a pre-therapy MRI model predicted therapy response and complete pathologic response with an area under the curve of greater than 0.912, and tumor length and thickness were found to be the most predictive factors for complete pathologic response. Signet ring rectal cancer is a rare subtype of rectal adenocarcinoma with a poor prognosis due to a high tendency for lymphatic, vascular, and perineural invasion. The imaging features of signet ring rectal cancer are not well described, so the study evaluated the MRI features of signet ring rectal cancer and correlated the imaging findings with outcomes. The authors found that common imaging features include T2 hyperintense signal, infiltrative growth pattern, and advanced T and N stage. Elevated serum CEA levels and intermediate T2 signal showed significant independent association with poor overall survival, and advanced end stage showed significant independent association with worse disease-free survival. These findings highlight MRI as a useful tool to diagnose signet ring rectal cancer, given the distinct MRI features and clinical features. For more details, you can read our blog where you can find links to the original publications. Please feel free to share your thoughts and questions with us on the GI forum, and see you next month.